Mr. President, in July of 2009, President Obama said, if you like your doctor, you can keep your doctor. If you like your current insurance, you can keep that insurance, period. End of story. And then later in September of 2009, the President said, and I quote again, now these steps, talking about Obamacare, will ensure that you, America's seniors, get the benefits that you've been promised, end quote. Well, Mr. President, last Friday, we saw yet another group of Americans fall victim to the Democrats' broken Obamacare promises. And this time, it was America's seniors. Obamacare cuts of over $300 billion to Medicare Advantage are already hurting seniors who rely on that popular program for their health care needs. More than 15 million seniors, close to about 30% of all Medicare recipients, are enrolled in Medicare Advantage plans. And the Wall Street Journal reports that approximately 1 out of every 2 new Medicare enrollees chooses Medicare Advantage. Seniors often choose Medicare Advantage because it's a more comprehensive and cohesive way to get health care services, and it offers seniors the chance to pick a plan that's right for them, instead of a one-size-fits-all approach picked for them by Washington, D.C. The administration's additional cuts to Medicare Advantage announced last week will make it even harder for America's seniors to keep their benefits plan and preferred doctor. The Kaiser Family Foundation estimates that more than 500,000 seniors will lose their current plans in 2014, which is direct violation of the President's promise. This administration's cut to Medicare Advantage in order to try and pay for Obamacare are having real-world impacts on people throughout the country. A constituent of mine, Cheryl from Box Elder, South Dakota, wrote to me this past week and said, and I quote, "My husband and I both pay for a Medicare Advantage plan. We've already had our original policy canceled because of Obamacare, and our prescription costs have increased for the same reason. So, I am practically begging you to do all that you can to keep our Advantage plan from being cut," end quote. Mr. President, every senior who voted, or every, I should say, senator who voted for this train wreck owes America's seniors like Cheryl an explanation for these Medicare cuts, which are already resulting in canceled plans, higher costs, and reduced access to the doctors that they had and that they liked. And Mr. President, when the Obamacare legislation was being debated and these proposed cuts to Medicare were being advanced, many of us said that this would be a big mistake, because what you're essentially doing is cutting Medicare, a program, particularly Medicare Advantage, that is especially helpful to a lot of seniors across this country, and frankly working out there, taking the savings and then using it to pay for a whole new entitlement program. And at the time when we talked about this, we said that, of course, they were because of the weird account or conventions that are used in trust fund accounting here in Washington, the hundreds of billions of dollars that were cut from Medicare were not only used then to pay for this new entitlement program for Obamacare, but also credited to the Medicare Trust Fund. So they argued that they were preserving and extending the lifespan of Medicare at the same time that they were using these savings from the cuts that are coming in Medicare Advantage to pay for a whole new entitlement program. Well, Madam President, I think for most Americans that would be spending the same money twice. It would be double counting revenue. Because essentially what you're saying is that we're going to put an IOU into the Medicare Trust Fund, basically a note that at some point in the future we're going to have to redeem to pay benefits, and that's going to require us to borrow more money. It's intergovernmental debt. We talk about publicly held debt, that's debt that's held by the public, but there's also intergovernmental debt, and that adds to the total debt burden that we place on American citizens, and debt that we're going to have to pay back in the future. Because essentially all you've done is said, you put a promissory note, you said it's an IOU into that trust fund, that at some point in the future, when we need to be able to pay benefits to beneficiaries, we're going to have to borrow the money to do that, to redeem that IOU. And so essentially what happened is they were able to argue that we were extending somehow the lifespan of Medicare at the very time that these cuts were being made, and also at the same time paying for a whole new entitlement program under Obamacare. It was spending the same money twice. It was double counting revenue, something that anywhere else in the country would probably land most Americans in jail. But that being said, Madam President, these Medicare Advantage cuts are now having real-world impact, something that we predicted all along. And Medicare Advantage, the reason it's a popular program, the reason that 1 in 2 new beneficiaries are signing up is it gives you options, it gives you choices. It provides competition, something that we need to have more of, not less of, in healthcare today. If you want to put downward pressure on prices, if you want to constrain utilization in healthcare, then create competition out there. Get people more, give them more ownership, give them more skin in the game, give them some personal investment, if you will, in their own healthcare decisions. As it is with a traditional Medicare program, we have a fee-for-service Medicare program. Many seniors are enrolled in that. But the Medicare Advantage gave them another option, an option that presented choices and options and opportunity to cover things that they want to see covered in their healthcare plan. And it has worked. It has been an effective program, one that I think most people point to as a success. So we're going to cut the very program that is working perhaps the best out there in terms of meeting the healthcare needs of America's seniors in order to fund a whole new entitlement program, ObamaCare, and in the meantime end up with these higher premiums, these canceled coverages, and all the dislocations that are coming as a result of these Medicare Advantage cuts to seniors across this country. Madam President, that is the wrong way in which to approach this issue. There was a much better way, one that relied more on the very things on which Medicare Advantage is based, and that's more competition, more choice, more options, which wouldn't have led to canceled coverages, higher premiums, higher deductibles, and fewer doctors and hospitals to choose from for America's seniors. But that's exactly where we are. And the American seniors are now experiencing the very thing that a lot of other Americans have already experienced. People who get their insurance in the individual marketplace have seen a lot of these canceled coverages already. They've seen these huge increases in premiums. Many of us have been down on the floor reading constituent mail, emails that we get in our offices from families and individuals who have been adversely impacted and harmed by Obamacare because of canceled coverages and higher premiums and higher deductibles and loss of doctors and hospitals. We've seen that in the individual marketplace. We're starting to see that. We're going to see more of this in the small business employer-provided marketplace. But now, Madam President, as of last week, the real impacts are being felt as well by seniors across this country who in big numbers have been signing up for Medicare Advantage. 15 million seniors, close to 30% of all Medicare recipients, are going to see as a result of this higher premiums and reduced access to health care because of the cuts that will occur to Medicare Advantage in order to pay for a new entitlement program, ObamaCare, which is already demonstrated based on the number of cancellations the administration has made, or I should say the number of delays the administration has made, that it is not working. And I've argued a long time, Madam President, as have many of my colleagues here, that it can't work because it's built upon a faulty foundation. There is a much better way to do this. We should do away with this approach, go back to the drawing board, use a step-by-step approach to reforming health care in this country, realizing that the status quo doesn't work, but realizing as well that the best way to get lower costs, more affordable health care, more accessible health care for more American citizens is to create downward pressure on prices. And that requires giving people choices, creating competition in the marketplace. Those are the things that we ought to be advocating and advancing rather than this top-down, government knows best, one-size-fits-all solution coming out of Washington, D.C., which is hurting more and more Americans, and most recently, American citizens who are experiencing now the adverse impacts of Obamacare because of the cuts to their very Medicare Advantage plans. Madam President, I yield the floor.